Hello and welcome. Today we are going to map out one of the most incredible journeys in life, labor and delivery. We're going to break down the science, the signs, the stages, everything you need to know, all in one simple guide. So let's get started.
But first, let's kick things off with a big question. With all of our incredible modern science, what's that one single thing that flips the switch in the body and says, okay, it's time? It's a really fascinating mystery, and that's where we're going to begin.
So here's our game plan for today. We'll start with what actually triggers childbirth. Then we'll get into the 4 essential P's of labor. We'll figure out how to tell the difference between true and false labor, walk through the 3 stages of delivery, and wrap up with how we keep an ear on the baby's heartbeat through it all.
So what is that initial spark? What gets the whole thing started? Well, the truth is, science doesn't really have one single, simple answer. It's not like flicking a light switch. It's more of a complex and kind of beautiful cascade of different events all happening at once.
Think of it like a giant, intricate puzzle. You've got one piece, which is the uterus stretching to its absolute limit. That's called uterine distension. At the exact same time, another piece falls into place. Key hormones start to shift. Then, the placenta, which has been the baby's life support for 9 months, starts to get a little old. And the final piece? The uterus becomes super sensitive to a hormone called oxytocin, which is what really gets contractions going. When all those pieces click together, the body knows it's go time.
Now, for labor to really be successful, there are 4 essential elements that have to work together just perfectly. We call them the 4 P's, and you can think of them as the main cast of characters in this incredible story.
First up, you have the powers. This is the engine driving everything forward. It's a 2-part system. You've got the involuntary contractions of the uterus doing the hard work of thinning and opening the cervix. And then later, you have the voluntary pushing from the mother that helps bring the baby into the world.
Next in our cast, we have the passage. This is literally the path the baby has to travel. It's made up of the mother's bony pelvis and all of her soft tissues. The specific shape and size of that pelvis plays a huge part in how smoothly this leg of the journey goes.
Our third P is, of course, the passenger, the baby. And what's just amazing here is that the baby is an active participant. The bones in a baby's skull aren't fused together yet, which allows the head to slightly change shape, or mold, so it can fit perfectly through the passage. How cool is that?
And finally, we have a character that is maybe the most underestimated of all, the psyche. A mother's mental and emotional state, her support system, her beliefs, all of this has a profound influence on her ability to cope and progress through labor. It's a really powerful reminder of that deep mind-body connection.
Okay, so the stage is set. All the characters are in place. But how do you know when the show is actually starting? Let's dig into the signs of labor and, most importantly, how to tell a false alarm from the main event.
Your body is pretty great at giving you some clues that it's getting ready. You might feel some practice contractions called Braxton Hicks. There's also lightening, which is when the baby drops down into the pelvis. You might suddenly feel like you can breathe a bit easier. Other signs include losing the mucus plug, which is sometimes called a bloody show, or, of course, your water breaking. And hey, if you get a sudden, intense urge to clean and organize the house, that's the nesting instinct kicking in.
Okay, so here's the million-dollar question. Is it the real deal or not? Here's how you tell. False labor contractions are totally irregular, they don't really have a pattern, and they might even go away if you walk around. True labor, on the other hand, finds a rhythm. The contractions become regular, they get stronger and closer together over time, and walking actually makes them more intense. But the one absolute, undeniable sign that it's go time, progressive change in the cervix. It has to be thinning out and opening up. That's the key.
All right, once true labor is confirmed, we enter the main event. And this part of the show is divided into 3 very distinct stages. Let's take a look at how it all unfolds.
So the 3 stages are dilation, expulsion, and placental delivery. The first stage is all about the cervix opening up. The second is the act of pushing in the birth of the baby. And the third and final stage is just delivering the placenta. Pretty straightforward, right? Well, let's break them down a little more. The first stage is definitely the longest, and it has its own little mini chapters. It starts with the latent phase. Here, contractions are pretty mild, and moms are often still excited, talkative, and cracking jokes. That then builds into the active phase, where contractions get much more serious and require real focus. And it all culminates in the transition phase. This is the shortest, but by far the most intense part of labor right before it's time to push. So, after all that hard work, the goal of stage 1 is achieved. The cervix is fully dilated to 10 centimeters. That's the signal for stage 2 to begin. We call it expulsion, but you probably know it as the pushing stage. This is where the mother's efforts work together with her contractions to guide the baby out into the world.
So the baby's here. But wait, there's one last little task. That's stage 3. The body now has to deliver the placenta, that amazing organ that nourished the baby for the whole pregnancy. This stage is usually really quick, typically lasting anywhere from just 5 to 30 minutes.
Now, throughout this whole intense and incredible journey, we can't forget about our little co-pilot, the baby. The medical team gets a constant status report on how they're doing by listening very closely to the baby's heartbeat.
The very first thing we look at is the baseline heart rate. For a healthy full-term baby, we want to see that number hanging out somewhere between 110 and 160 beats per minute. This baseline is sort of the foundation for understanding everything else we see on the monitor.
But it's not just about the number itself. It's about the variability. See, a healthy, happy baby's heart rate isn't a flat line. It has these little constant zigzags and fluctuations up and down. We call this moderate variability. And it's one of the best and most reassuring signs that the baby is handling labor well and getting plenty of oxygen.
So, to quickly and easily understand what all those different squiggles and patterns on the heart rate monitor mean, clinicians use this brilliant little memory trick. It's called VEAL CHOP, and it is the absolute key to decoding what the baby is telling us.
Okay, let's just walk right through it. Each letter in VEAL corresponds to a letter in CHOP, and it tells you the what and the why. So, a variable deceleration points to cord compression. An early deceleration means head compression, which is actually normal during pushing. An acceleration is great. It means oxygenation is okay. And finally, a late deceleration can point to a placental issue. See? Simple.
Now, of those patterns we just talked about, there are two that really make the medical team pay close attention. Those are late decelerations, which suggest the placenta might not be delivering enough oxygen, and significant variable decelerations, which mean the umbilical cord might be getting squeezed. And in both of these situations, you know what the first and often most effective intervention is? Simply helping the mom change her position. It's amazing how often that alone can relieve the pressure and fix the problem.
And there you have it, a complete map of the journey of labor and delivery, from that first mysterious spark all the way to the final stage. We've seen how the body gets ready, how it makes progress, and how we make sure that both mom and baby are safe every step of the way. So now that you have the map, the question is, what part of this incredible journey are you most curious to explore next?